Hi. So I am going to be talking. I'm Ruby Messick, and I'm going to be talking about emotional disturbance disorders. Um, so that's one of the 13 things that fall under IDEA. And so for the statistics, it affects about 17.1 million students. That's the estimate of how many are affected by psychiatric disorders. And about 50% of these disorders appear before age 14. Um, okay, so there are a few causes of this. They're kind of built on top of each other, mixed together. It's not like a super cut and dry thing. As with most of these disabilities, um, as with many of these disabilities, there's not a clear cause, but um, it includes genetics, having a brain disorder, your diet, stress, environment, especially your family environment, and like the way that you were raised, um, and things like that. Um, so, so it's important for understanding this, like to see how the is legally defined as something that can fall under IDEA. So, first thing is an inability to learn that cannot be explained by intellectual, sensory, or health factors. Another is that there is an inability to build or maintain satisfactory interpersonal relationships with peers and teachers. Then there's inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. So all of this is just to say that, just to define how, like, there needs to, just to see how these disorders or these disturbances might have an adverse effect on their educational experience. So there's a few kinds of emotional disturbances. Um, and then, yeah, it's an umbrella term for a lot of things. So one of the main ones is anxiety. It's very common. In fact, it is the most common of the emotional disturbances. It is characterized by persistent fear or worry and irrational fears. It's an umbrella term for many different disorders. So there's generalized anxiety disorder, where you just kind of have anxiety about, in general, as the name suggests, and the panic disorder, obsessive compulsive disorder, or OCD, which I'll get into in just a second. PTSD and social anxiety disorder, where you are specifically having anxiety about social interactions. So obsessive compulsive disorder kind of has its own thing because it's just a little bit unique. Um, um, it is characterized by having recurring unwanted thoughts, and then you have repetitive behaviors to get rid of the thoughts or have relief from like the unwanted thoughts. And then not performing these behaviors can increase anxiety. And just as a reminder, like this isn't, there's lots of different forms of OCD. There's a lot of things that people have OCD about, and it's not always as obvious as like constant washing your hands or things like that. It can take a lot of forms. And so treatments include therapy, cognitive behavioral therapy, and medication. And the medications tend to be antidepressants. And so for bipolar disorder, you have manic highs or irritability, and then you also have depressive lows. It's kind of rarer in children and teens, so it's not going to be as common as some of these other ones. And then the treatments include medication and psychosocial treatment. So for conduct disorders, it's a repeated pattern of aggression and kind of more serious, like rule breaking, destruction of property, lying, stealing, truancy, and then kind of like a little bit of like a different reaction than most students have, like maybe less guilt or things like that. It affects 1 to to 4% of the population. It's more common in males, and there's lots of different therapies that work for this, like group therapies, family therapies, individual therapy. So, yeah. And then there are eating disorders, and there's lots of different kinds of eating disorders, but generally they're characterized by eating too much or too little and just having a disordered relationship with food. It is usually tied to weight or feeling healthy. It's more common in females, but it's definitely also present in males. Two of the more common ones are anorexia, and that's where you just starve yourself, you don't eat. And then bulimia is where you do eat, and then you kind of like purge what you eat by throwing up. And then there's psychotic disorders, and that's an umbrella term for lots of different disorders, but in the general characteristics include delusions and hallucinations. One of the more well-known manifestations of a psychotic disorder is a schizophrenia, and treatment includes medication and psychotherapy. So, how does this all work in a classroom? Because this is a class about how we teach students with these disabilities. So there's a few different helps offered. Like in general, you're going to have emotional support, behavioral support, and academic support because obviously it's an emotional disturbance. So the student will be experiencing adverse emotions, and there can also be behaviors tied to that are either disruptive to other students or disruptive to the student who is experiencing this disorder. And then academic support can be important because you don't always have, it's hard to do school when you are worried about your emotional safety. And so this can be implemented through an individual education plan or IEP. And then you want to have positive behavioral support to help them in their day-to-day working in the school. And then in some cases, they qualify for psychological or counseling services to help them with their disorder. All right, so in a handbook about specifically this category from the emotional disorder guidelines for serving students with emotional disturbance in educational settings. I found this helpful graphic, and so one of the things that you can do is you make sure you have a good setting for learning, and that's the physical layout of the classroom, how it's designed, and then you have routines, and then you have expectations, like clear rules, and then you want to have prevention and response. So you want to try your best to take action to prevent adverse behaviors from happening, or bad things from happening to your students. So you're going to supervise them, you're going to give them opportunities to participate, you're going to acknowledge what they do right, and you're going to prompt correct behavior. And if a bad behavior does end up happening, you correct specifically and not overemphasize the situation, just calmly handle it, and then be careful not to reward the incorrect behavior, and create a learning opportunity when possible. And then you want to collect data about that. So other strategies that the handbook talked about are peer-assisted learning, self-management interventions, controlled environment, so small class size, communication, student advocacy, parent support, and then so that was kind of more of the more of an social structure, but then there's also the physical structure of the room arrangement, the lights, the materials that you use, even the noise levels can affect how the students learn. So just be aware of that. And then routines are good, and obviously behavior management. All right, these are my sources, and thank you for listening.